yeah, it's fine, but not in my backyard.
Right, and also we've got to remember that, that our federal government and state governments have been spending literally hundreds of millions of dollars a year convincing people for scores of years that your brain is an egg and marijuana is a very hot frying pan. And, you know, if you do that marijuana, it's going to fry your brain.
I just remembered that ad, and I love that ad. I was like, this is the dumbest thing ever. I had to give him points, though, for being very succinct in getting the message across. Like, I looked at that, and I'm like, that's some good marketing, you know?
Yeah.
And made all the more sort of admirable by the fact that it was such complete bullshit that, like, that they could convince anybody with that, you know, metaphor was really impressive.
Right, well, of course, and a big part of it is they're lumping cannabis together with other illegal drugs, and you know, I mean, anybody who knows anything about cannabis knows it's basically non-toxic. Actually, I have a little story about that. There is a man who was killed by cannabis. In, I think it was about 1850, he was working in a hemp warehouse, and a pile of hemp bales fell over on top of him and crushed him to death. And he's the only person I know who was actually killed by cannabis. Of course, people use marijuana and do stupid things and kill themselves, but people do stupid things and kill themselves with or without marijuana. It doesn't necessarily have much to do with the marijuana.
I was at a conference last spring in Colorado where they had invited the Denver police chief down to give an update. No, it was not the police chief, it was the coroner, to give an update on sort of how many deaths had occurred. And he said, well, there are none, so what am I going to talk about? So he managed to talk about a guy who died in Denver because he had smoked some weed and they were up on the balcony and they were taking a photo and he stepped backwards and he flipped off the balcony and landed on the ground. So, like, is that the weed? Well, apparently that's as close as we could get to finding a weed fatality.
And these are the stories that people need to hear and
Right.
put in context, right?
Right. I mean, especially when, you know, as a doctor, I'm sure you know, almost anything that you could recommend to a patient, much less prescribe, is toxic. Even aspirin, we think of aspirin as being the safest medicine. And a 5-year-old can go into a drugstore and buy a big bottle of aspirin and nobody blinks, nobody thinks twice about it. But about 2,000 people a year in the US die from aspirin.
Oh, it's much larger than that. Much
Is
higher
it?
number.
Yeah?
Yeah.
There you
Probably
go.
closer to 20 to 40,000.
Oh my God, they've got to ban that aspirin stuff. Can you imagine children and aspirin? Ah!
Yeah, I mean, the problem is, you know, we want everything to be perfect, and medicines are not perfect. And for millions and millions of Americans, aspirin and many other medications are either curative or are very helpful in treating whatever their conditions are. But, you know, there's this concept of social cost. There's a risk, and the risks are real, which is to say that if you treat 1 million people, you're going to have several thousand who are going to have adverse events, whether they're lethal or not lethal. And aspirin is certainly not a safe medicine, right? As you mentioned earlier, it can cause bleeding ulcers in the gut, and it can cause kidney failure. On the other hand, it staves off heart attacks all the time, right? So it's really a matter of how much are you using, why are you using it, are you using it appropriately? And that's true of every medicine, whether we're talking about aspirin or blood pressure medication or Percocet or any of these sorts of things. And cannabis is exactly the same, but in fact, less risky, right? And so, yes, there are people for whom cannabis is not a good idea, but it's a small group, and the consequences tend to be less consequential. So, again, at least in the medical practice, if you apply some intelligence and training to this, we can focus this in a way that maximizes the benefit and minimizes whatever potential harms there might be.
That's it, we've legalized marijuana, it's all done. We've solved the problem.
Fixed
Thank
it.
goodness. You know, one of the things that we spoke about at the conference, and Jordan and I agree on wholeheartedly, is that there is good science showing, number one, that there are issues that are directly related to people's endocannabinoid systems being insufficient. That there is such a thing as clinical endocannabinoid deficiency, and that by supplementing your endocannabinoid system with phytocannabinoids, plant-based cannabinoids, some people find a great degree of efficacy. And that degree of efficacy may vary depending on how strong your endocannabinoid production is.
It's a very interesting theory, you know, and it sort of echoes. I'm sure most of our audience has had some experience with an SSRI, right? And we have this theory that depression can be caused by an absence or a lack of serotonin, right? And so we have these medications that increase serotonin levels, and they're very effective for some people some of the time. And so this is a very similar idea, that for some people, there isn't enough of our endocannabinoids running around in our body. And then if we supplement them, as Bill mentioned, then we may feel better. Of course, both of these are theories. We've never been able to sort of measure these things, although there have been some attempts. But the problem is most people aren't so willing to let us slice up their brains while they're still using them,
Right.
to paraphrase Monty Python. But, you know, that's the essence. What we can see is that there are some people whose peripheral blood has lower degrees of endocannabinoids. Now, do we know what that means exactly? No, but that's a starting point, and it does give some credence to this idea that there's a range of people, and that somehow that may play a factor in their illness.
Well, and it also makes sense, you know, just on the very sort of basic level, that this plant has been illegal and taken out of our food system, you know, taken out of all of our systems for all these years. So perhaps, you know, there's a cause for, you know, this lessening of the endocannabinoid system in one population group over another. But, you know, we won't know that until.
That's right, and as Jordan mentioned, I think during our conference, some of this might be environmental factors. There may be, for instance, toxins in our environment that are causing people to have less efficient endocannabinoid systems.
I'm not even sure we have to think about toxins, though certainly the option or the possibility of there being toxins in our environment is huge. But how about just our society? I mean, I think that if you look at the number of people running around feeling ill in one form or another in our American society, it's very disproportionate with other societies that are sort of, you know, equally economically advantaged. So what's going on, and why are we Americans so uniquely unhappy? I think that's a really important question to answer, and I think that's above all of our pay grades, but it needs to happen.
It does.
Yeah.
Absolutely.
And if we can affect some of that with cannabis and make people happier and more productive, then yay, right?
Yeah.
Right on. And
Cool.
another big topic that I know Jordan and I are of similar mind, and we addressed in our part of the conference, is the idea that while certain cannabinoids may have a certain effect to some degree in isolation, for instance, THC or CBD or CBN or CBG, these are all chemicals unique to the cannabis plant. Some of the best research is that it's combinations of cannabinoids that actually are most medically effective, and also combinations of cannabinoids with another whole set of chemicals called terpenes, which show the best promise as far as cannabis goes. And that's why there's this idea of using whole plant products being perhaps more effective than using an isolate or a synthetic.
I've always believed that, sort of intuitively, that it is about the whole plant. Absolutely.
I think it's really interesting that, you know, for many people who come to cannabis through various activism or personal use and that sort of thing, there has been this kind of gestalt, as you say, of the whole plant is better than its parts. But what's really interesting to me as a physician, which means I straddle both the the lay interpretation and the purely scientific interpretation is that the science is really bearing this out, and that we have studies coming out of Israel, for example, Dr. Mary's lab, which shows that if you take cancer cells in a test tube and you add THC, you'll knock them off. And if you add CBD, you'll knock them off. But if you add whole plant extracts, you knock them off best, right? And so clearly THC is important, clearly CBD is important, but clearly there's also something else, or maybe many something else's, in there that we have yet to put our fingers on that make this whole thing work best. And that this is something that rather confounds modern pharmaceutical development. We have, this started in 1850. The company that we call Bayer invented aspirin, coming back to that, by distilling aminosalicylic acid out of willow bark. And that set the stage for a lot of drug development. But the concept was, let's go to nature and find something that does something, and then we will figure out what the chemical is and put it in a pill. And I gotta say that for the last 170 years, that's worked really well. But the question is, when we look at cannabis, we realize that there are many moving parts and that you can't sort of deconstruct it so easily. And as we research those parts and understand better how they interact with each other, not only will we understand cannabis better as well as the biology of the human being, but what I think is really exciting is how much will we be able to go back into our universe and find new medicines that have nothing to do with cannabis, but simply we overlooked them because we were looking for single agent drugs. And now that we understand cannabis, we have a methodology by which we can explore other non-cannabis related polychemical mixtures.
And of course, the FDA approval process is all based on molecular science and on single molecule medicines. And this concept that you can have many different chemicals working in coordination with each other to give the full medical effect is too, it's beyond their, like you say, beyond their pay scale, although their pay scale is hundreds of billions of dollars. They still can't get past this idea that, oh, it's got to be a molecule. It can't be like more than one. That's too confusing.
Well, I'd like to rip on the FDA a little bit less, but let me say this, that there is a paradigm that's been based on a particular successful approach. This substance challenges that. I don't believe for a minute that the FDA can't grow into this understanding, but it's going to take a fair amount of science to convince them, and that science is blocked not by the FDA, but by the DEA. And so, the politics are hampering progress. We'll get there. It's a matter of time and effort, and we will move the federal government, at which point we will be able to get the kinds of studies done that we need. Frankly, in this country, I don't think it would take that much money or that much time to get the kinds of results we need. $50 to $100 million, which in the grand scheme of things sounds like a lot to us, but it isn't. And maybe, 3 or 5 years. But that's after we streamline the process of actually getting those grants out to people.
So the DEA made an announcement that they were going to license production of cannabis for research purposes to other locations. Right now, there's only one. It's the University of Mississippi. And since then, they've had many, many applicants, on the order of 50 or 60 applicants looking to do growth of research cannabis. Unfortunately, our Attorney General has been blocking all of them. And there is no one facility other than University of Mississippi that's allowed to grow cannabis for research.
Yep, we gotta fix the policy. We'll get there.
Yes.